It's Mari McInerney from Croaky here, talking to Professor Louise Newman here at the Royal Melbourne Women's Hospital. Louise, you have been in the space of advocacy for asylum seekers and refugees for a long time, and you were behind a lot of the work for having this discussion today. Why did you want to do this?
I think it was a really great opportunity, and we were trying to pull together some of the really important health professional and medical groups who are involved in the issue. We've got a groundswell of concern, clearly, about what's been going on, particularly in offshore settings. We've had petitions from doctors and other clinicians on the ground raising concerns about children on Nauru. There's also concern about Manus Island. And the issue is really one, I think, of organising, and who do we need to pull together to actually have an organised and appropriate strategy for raising awareness amongst the profession, but also giving the profession a greater voice in these issues.
And do you feel you got that today?
I think we had an amazing dialogue. I think it was very important to feel the consensus. Obviously there'll be different opinions about political strategy, but there was a consensus that things need to change. And there was also, I think, a very clear message from the audience in terms of their questions and comments that it is an ethical and moral responsibility to actually have a view on these issues. That doctors and clinicians, when we become aware of human rights violations and any government policy of whatever political complexion that damages people who are very vulnerable to begin with, that we do need to speak about that. I think there are some clear comments that being bystanders in the face of real violations is actually to accept them and to be complicit. We need to avoid that as a position of ethical compromise. Much more appropriately, we need to raise the issues, document concerns, and collectively think about the best way of intervening. So we had senior leaders in the room today, groups from the AMA to the various professional bodies to clinicians on the ground who did share that sort of vision.
You did talk about ethical dilemmas for medical professionals in this whole thing, and you disagreed with lawyer George Newhouse about whether or not it's good to have doctors working in detention centres. What's your position on that?
Look, I think it's a very complex issue. The issue is not so much do we try and help people in detention. Of course we do. I've done that for 20 years and I will continue to do so. These people desperately need high quality care, they need expert opinions. The question is, how much do we work within the system in a way that might prop up a system when the system itself, the system of detention and mandatory prolonged detention, is actually the thing that damages people. So particularly when you think about psychological problems, if deprivation of liberty, human rights abuses, being detained on a Pacific island without care is what damages you, then the answer is not really to prop people up there and put band-aids on them. The answer is really to overhaul the system. The other issue that raises fundamental ethical problems for doctors and others is if they're working within the system where the system doesn't listen to their recommendations, refuses to follow their advice, and this is why doctors and others have resigned from working in these settings. That's the core of the issue. Doctors are there to treat the people who are their patients, the asylum seekers and refugees. When medical decisions can be overridden by bureaucrats in Canberra purely for political reasons, which is exactly what's happened time and time again, or there's inordinate delay in getting people care, then that doctor's role is fundamentally compromised. That's when the ethical dilemma comes about. I personally would not work in a way within a system that means I can't practice appropriately to standards that are shared by the profession, or when I have no power. I think that's where the dilemmas come. So it's not a simple issue of should we or shouldn't we. It's can the system be made safe in any way for the patients, and should there be a different governance of these sorts of systems where health decisions are made by health people, not made by immigration people.
Can we talk about, because there was a real sense of momentum, as you said, and a sense that we are at a tipping point.
Yes.
You would think that it didn't have to take this long to get to that point, that health professionals would have been absolutely alert and agitated about this over some time. What have been the barriers to get to this point?
Well, I'd actually say that health professionals have been very alert to it. This is the second round of detention, not the first. We've been here before, just because I've been here for a while doing this work. I was involved in the very broad alliance of medical professional groups and other health groups that formed around 2000, when we had a huge lobby about health standards and the need of care for these people. And the health lobby was hugely significant. We had government inquiries into detention, and we did have improvements. Now, the problem is that that didn't last, and that's when politics interferes with it. We had a honeymoon period. I was chair of the Detention Expert Health Advisory Group, advising the federal government on how to make these systems at least safe with basic standards. Now, for better or for worse, our group was dismantled and sacked by the Abbott government, sort of a bit of a badge of honour to be sacked by Tony Abbott, which I will look back on very fondly, I'm sure. But what it signified was that they wanted advisors who didn't give them advice about maybe dismantling detention, limiting the time in detention. We advised about not detaining children and vulnerable people, survivors of torture and trauma, and protecting women and children. What we saw in practice was a going backwards to the extent that we have the situation of utter crisis that we have now. That's the tragedy. And I think politically that's hugely important that we know the history, because government cannot say they were not told what this system could do to people. They know precisely what the evidence says. We've done research, we've documented it, they know. And yet for political reasons, their particular reasons, political judgment on both sides of politics, there's been blanket support for an unsustainable policy of offshore processing and a refusal to act in a humanitarian way in full consciousness of harm.
And are there lessons from that setback for the health profession and for wider advocates about how not to have that happen again?
I think there are, and I'm not meaning to sound bitter and cynical, but we need to have our eyes wide open. The politics of this issue is some of the most complex politics of any issue. Maybe climate change would be the second most complex at the moment. But this raises core issues at a time of rising populism, nationalism and right-wing politics. This issue will be used, particularly by the right, for whatever reasons they choose to. We have conscious, deliberate policies and approaches that are designed to raise concerns about particular groups. The language of invasion and danger is rife. That's what we need to be aware of and counter. We can't afford to be naive and to think that if a group of doctors and health professionals speak up, it all gets better. I might myself have thought that right at the beginning many years ago, and we had some victories. I'm not saying that they weren't important, but we've learnt a lot through that. Look, sadly, politics is a very difficult game. We need to be as knowledgeable about that system as we are about our own system if we're going to be effective in this space.
Thank you very much.